Hi, everyone. This is Dr. Isabelle Amigues, your friendly rheumatologist. And this is another live with Rheumatology 101. Today, a question that comes very often, which is when should you see a rheumatologist? So, for those of you who do not know me, and I'm sorry there's a glare. For those of you who do not know me, I'm Dr. Isabelle Amigues. I'm a rheumatologist in the direct care environment, meaning that we work with insurance, but we do not take insurance. I work directly with patients, and my work is directly paid by my patients. So my time is for my patients. Why this is important? Because then I have more time to fight for my patients for insurance. I have more time to figure out what's going on for my patient. I have more time to make sure that we reach remission for my patients. My goal in life is to put as many patients in remission as possible, that any of the patients who comes from my practice goes into remission after one, figuring out what they have, and two, getting them to remission. Okay. So, rheumatology. What is rheumatology? Rheumatology is the science of inflammation. Really, there's so many definition of what rheumatology is, but I think in a nutshell, it's the science of inflammation. That inflammation very often in rheumatology is caused by autoinflammatory and autoimmune disorder. So if you go back to, I think it was my last video, my last Rheumatology 101, which can be found in YouTube at Rheumatology 101 by Dr. Isabelle Amigues. You can actually see this discussion that I had about what inflammation is, what does it mean when you feel like you have the flu, and what it does for you, right? So the science of inflammation is just that, right? And so our job as rheumatologists is to figure out why you are inflamed, why you have a process that's causing inflammation. And the inflammation can present in many ways. You can develop joint pain that's inflammatory, so worse in the morning, associated with morning stiffness, associated with swelling of the joint. You can also develop some symptoms all over your body where you may develop skin rashes, you may develop severe fatigue, fever, lymph nodes, so enlarged lymph nodes. You may develop kidney issues, you may develop liver issues, lung issues, heart issues, right? So if you actually take the person, you realize that every single organ can be affected, because in rheumatology, it's not just one system that can be affected, but all of the system. And our work in rheumatology is to make sure that we go back in track and that this inflammation is completely resolved after you see us. Okay. So some of the reason you want to see a rheumatologist, and you want to see them fast. Why? Because if there is an inflammatory process, the inflammation that is ongoing, that is out of balance in your body, that can cause issues into your organs. So, for example, you can develop renal failure, you can develop heart failure, you can develop lung issues, right? Those are the worst. You can also develop destruction of your joint. You can have issues with your eyes and so on. If you really think of it from this continuum perspective, the more you leave inflammation, the harder it's going to be to get rid of it. So think of a fire. When it starts, it's just a little spark. And when it starts, at first, you have really just a little fire, nothing major. You can probably take it out and it's not a big deal, right? And we've all seen cases of that, where there's a fire, you just, put something on it, water or whatever, like maybe a towel, you stop it and you don't think about it. If you were to leave that fire ongoing, the issue is that it spreads. And because it spreads, it becomes much harder to contain. So you want to see a rheumatologist if you have any sort of inflammatory symptoms. So, and I'm going to explain to you what it looks like. And the way I'm going to explain it to you are going to be through different cases, okay? Cases that I've seen throughout the years. There's a really good news into this, is that the earlier you take care of it, the faster you can get patients into remission. And the faster you get into remission, the least chance you have of having flares and relapses. That is actually really important. Okay. The faster you get into remission, the better the outcome. Okay. So this is actually really awesome, because that means in 2025 that we can really help you. Okay. So couple of cases that are definitely rheumatologic, and I'm really happy to see patients with this, right? It's a patient that has had joint pain, and the joint pain is inflammatory, right? So that is probably the most obvious one, right? Like you have joint pain and it's worse in the morning, and there's a little bit or a lot of morning stiffness. There may be some swelling. Please go and see your rheumatologist. That needs to be treated by a rheumatologist, not just because we need to make a diagnosis, but also because we need to put you in full remission. Really important. If you have this, please come and see me. info@onaveragem.com, and we will get you on the schedule. Okay. And why it's so important is that I really, really want to put patient in remission as soon as possible. Okay. The second is a patient that has dry eyes, dry mouth, and that just doesn't feel right. This can be Sjogren, and we can help. Okay. Some other causes would be like that if you were to have several symptoms. So maybe it's hair loss, maybe it's fatigue, maybe it's some sort of fever, maybe it's shortness of breath, chest pain, but it's really something where you feel it's not just one organ. Something is going on. I'm young, I'm less than 60, something is going on, okay? Other cases would be, I have a headache and we check your inflammatory markers and they're high. Please come see a rheumatologist as soon as possible. This can actually be an emergency. Okay. Finally, when you well, it's not finally, we have so many options, right? So many causes for you to come and see rheumatology. One that I really enjoy doing personally as a rheumatologist that has been very trained for a very long time, because I really do love rheumatology, is when other people do not know what's going on. And with the system currently where you are only seen for 15, 20, 30 minutes or 40 minutes, at the max, I don't think that this is a system that can get to figuring out what's going on when it's complex. And that is one of my zone of genius. I absolutely adore doing this. Normally, any rheumatologist could do that. I think in the system right now, it's a little harder. In the insurance system. So I recommend that you come, same thing, info@onaveragem.com, and you can get on our schedule, okay? That's when no one knows what's going on and you're very clearly understanding something is going on with you, please come, because we can figure it out. I have made diagnosis of diabetes. I've made diagnosis of infection. I've made diagnosis of cancer at a way earlier stage than if we had waited many months. Okay. And we can then treat it. You don't have to be afraid. We can treat all of this. Okay. Another reason to see a rheumatologist is if you have been diagnosed with a rheumatologic disorder and you feel like you are not getting into full remission. That is really important. With the treatments we have nowadays, we can get you in full remission the vast, vast, vast majority of the time. And so it's a disservice to you to not get there, because we can get you there. Okay. Rheumatology is a very it's not as easy to understand the word rheumatology as if we were discussing cardiology or pulmonology or kidney nephrology, right? For the kidneys. And at the end of the day, what I want to say is, if you feel like there is some sort of ongoing inflammation that is affecting more than one of the organs, that maybe you have some feelings that the skin is affected, the joint is affected, the hair is affected, the eyes are affected, the mouth, and so on, this is when you want to see a rheumatologist, and we will scratch our head for you. Sometimes we don't scratch our head at all because we figure it out very fast. Okay. At the end of the day, if you don't have an answer right now, I highly recommend you see a rheumatologist, because even if it is not rheumatology, and I told you some cases where it wasn't rheumatology, we are trained to figure it out. And that is exactly why I opened On a Bridge MD. It's because I really, really wanted to offer the best of me to my patients, because I knew that time gives us the answers. So if you are interested in coming into the practice on abridgemd.com, we are getting at this time where we're getting more and more busy. And so to make sure that we are not too busy, the way I do it, because I really want to offer the best care to my patients, is that I increase prices as it goes so that we are not overwhelmed, right? But I always take new patients, because my goal in life is to get people into remission, to get patients into remission. So if you are interested in seeing me, please contact us. We have space. Our prices increase, but they will. And so I highly recommend you work with us, and you work with me, so we can figure out how to get you to remission, how to figure out what's going on for you so that you can live the life that you deserve. With that said, I wish you a wonderful week, and I will see you next week. If you are seeing this replay, please say #replay. Okay. And let me look a little bit at those who are here. Hi, Paula. Hi, 2020. Hi, Nicole. Such a pleasure to see you. Rock Dove, I'm sure you're here. And if you're not here just yet, I'm sure you will be here. And Up Yup, yes, I do not accept insurances because the insurance system crushes physician at this time. This is why most of the time you don't even see a physician. You see a nurse practitioner or a physician assistant, who are maybe wonderful human beings, but do not have the training that rheumatologists have. And so I, at this point in my career, cannot recommend anyone in the insurance system, because I am seeing physicians being crushed, and I'm seeing patients not getting good care because of the system, not because that the physicians are not good. They are amazing. I love my colleagues. I think they are phenomenal. But the insurance system is crushing the physician, and I cannot recommend anything. And hi, Keith. So many varieties of immune disease, and a few of us present in the same way. Where do you begin your diagnosis? And hi, right? I knew you were going to say hi, and it's always a pleasure to see you. Yeah, it's because it's the inflammatory response. The inflammation is what it's basically, at the end of the day, it's all causing inflammation, and it's causing inflammation from different pathways. And the work that a rheumatologist has to do is to figure out which pathway it is involving. And that's our job. So for example, if you have a skin rash and you have kidney involvement, that is when we're thinking vasculitis, right? If you have involvement and a certain type of lung involvement with some antibodies, that's telling us something. So it's really a detective work of figuring out how things are looking. And it's our job to figure out the pathway, because once we figure out the pathway, we can figure out how to treat. All right. So, and it will, so your office manager explained that to me, and my insurance won't let me see anyone outside of it. I'm not sure what the only insurance in Colorado, Up Yup. First of all, I'm really sorry. This is why I hate insurance. Medicaid does not allow us. It's actually, I don't know that it's a crime, but I'm not legally authorized to see any Medicaid patient, even if they want to pay for themselves. I don't understand this rule. It doesn't make sense to me. But I cannot see someone if I'm going to have lawsuits behind. And so I'm not really sure. But then you can always call Medicaid and ask them who they would allow you to see. The other thing I'm going to share with you guys is that very soon I'm going to create a coaching program, because I am realizing that you could absolutely have your own rheumatologist that's insurance based, especially if you have Medicaid and you cannot see me, right? And I can coach you, because there's a huge amount of coaching into taking care of a rheumatology patient. So this is something that I'm being asked to do, and I'm trying to figure out how to do it. So I'm just letting you know that. Yeah, ask your insurance. They will help you. Okay. And I'm here for you and I'm rooting for you. Please, 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 no matter who you see, realize that remission is the goal. Okay. Without further ado, I'll see you next week. Thank you so very much, everyone. Take care.